Well, if you felt a little more lethargic this week, despite getting an extra hour of sleep, you're not alone. And it's not because of the election. Joining us to talk about why we are a little more sleepy is Dr. Richard Chaffoo. Doctor, thanks for being here.
Good to see you, Jen.
All right, so what's going on here? Is this seasonal affective disorder, or SAD is appropriately named?
Very appropriately named. And you know, the thing is, Jen, that there's a normal circadian rhythm to sleep. So we know during the waking time, there's more serotonin and cortisol that keeps us awake. And then at night, there's more of what's called melatonin and other factors that allow us to be drowsy and sleep. And so with the seasonal affective disorder, what happens, Jen, is that we're seeing shorter daytimes. And of course, with a shorter day, what it means that we're in darkness much longer. And so we're actually stimulating melatonin. So we're actually drowsy for more of the day at the later part of the day when we should be awake. So there is this disruption, this normal circadian rhythm, and so people become sleep deprived. And certainly what they found in studies in Denmark that were also substantiated by Stanford is that we see an increase in what's called SAD, or seasonal affective disorder, of up to about 10%. Now what happens is that during these times of shorter days, especially in the winter, we're seeing depression that's significant enough in some cases to require hospitalization, medications, along with that occasional suicide ideations. We know that if there's long-term sleep deprivation, this can have significant physiological effects. It can cause problems with increased cardiovascular disease associated with obesity and also with stroke. So certainly we can see, in addition to psychological effects, physical effects as well.
Yes, we took that grill camera shot. You know, the sun now sets. We used to walk out of work and the sun would still be up. Now it's setting right before 5 o'clock.
Exactly.
We're a week into daylight, the end of daylight saving time. Is it too late to sort of correct our sleepiness or lack of sleep and prepare for the time change, or do we just have to wait till the spring?
Well, we don't want to wait for those springs, certainly. And what we need to do, Jen, is to realize that, you know, if we're sleepy and we're driving home, the problem is that the National Institutes of Health have actually shown in the transportation centers that we've actually got increased incidence of accidents, about 300,000 a year, that are related to one's drowsiness. So certainly want to be more awake. So what do we do about this sleepiness? Well, you know, researchers have told us that we should prepare for sleep and make sure that our room is dark, there's not a loud noise, we're not on our computers or phones right before we go to bed. Make sure we're getting at least 7 to 8 hours of sleep. The normal adult person requires at least that many hours of sleep a night. And now, getting up in the morning, the important thing is that we find cortisol, which is a naturally occurring hormone in our body, wakes us up. Even though it's light early in the morning, we're not oftentimes taking advantage of that because it's outdoors. So researchers have told us, you know, it's a good idea to about half an hour before your alarm goes off, have a light that goes off in your home. You have brightness in your bedroom. Go out for an early morning walk. And those will be things that will actually begin to stimulate cortisol, will allow you to shift the circadian rhythm into the daylight savings time and reduce that drowsiness and reduce that seasonal affective disorder, so we can all kind of go through this period of time more effectively.
Well, Dr. Chaffoo, I think a lot of people in this country are feeling sad. Whether it's because of the seasonal affective disorder is yet to be seen. Thank you for being here.
Thank you, Jen.